everybody, welcome to Fact Friday. So today, this is my dog, this is Daphne. I'm going to talk about low back pain. So one of the common things that people do when they experience, let's say they're lifting and they feel, oh, I hurt my back, I feel some low back pain, is it's scary. And so one of the natural things to do is to be fearful of movement. And if you look at old school theory of managing low back pain, what they would tell their patients to do is to do typical bed rest, take some anti-inflammatories, and don't move and be afraid to move in whatever position would cause pain. Well, that's not what we found historically to help. So the biggest thing that you can do is move. And what I want to show you today is a few things about how to determine maybe how to move. So let's say, for example, you have some back pain, and what I'd like you to do is think about what kind of things aggravate your back. So if you have pain with sitting for a long time, sitting is a bending type of position. And if you notice that in addition to that, if you bend forward, that also aggravates your back, then what you might want to try is doing the opposite type of movement and see if that alleviates some of your symptoms. So for example, what you could do is just use a wall, and you can follow me. So if you use a wall and you kind of position yourself a little bit away from the wall and then just let your pelvis kind of rock into the wall, and you could try that a few times. And initially you might feel a little bit of pain, but see after doing a few times if your pain goes down. If it does, then do that maybe as an initial exercise. You could also lay on the floor, and my dog might totally attack me here. Okay, and it's always fun to do with animals. This is like goat yoga. You can come up on your elbows in this position and see if that brings some pain relief. And you can also do some coming up on your elbows and see if that helps. Another nice exercise that we like to teach is called hand heel rock. And so if you get, I love you, Daphne. If you get on your hands and knees and you rock this way to this way, and what you might find is that one position might be a little bit more uncomfortable and another position is pain relieving, meaning back on your heels or up on your elbows. And so go in the range of motion that is actually pain-free. And so early movement is the key. Walking. If walking is not painful, then go for a walk. You want to move. If sitting is aggravating, you want to minimize sitting. Put some support behind your back. Now, if sitting brings relief, then the opposite is the case. So if you have pain when you're up standing for a long time, or if you're walking, then you might want to kind of find some strategies to reduce that. And exercises such as putting your hands on your knees and allowing your upper back and lower back to round may allow you to tolerate standing for a little bit longer, or sitting in a chair and bringing your knees to your chest, or laying on your back if you have the opportunity and just bringing your knees to your chest, and even rocking like this. So those are examples of just some simple exercises to get acute pain under control. Now, the other thing I want to emphasize is with low back pain, if it doesn't go away in a couple days, you really do want to seek care and come visit a physical therapist, because we know we're movement specialists and we are quickly able to identify if it's going to be managed conservatively. And if you catch low back pain in the first 4 weeks, the evidence is amazing in terms of getting you better quickly within a few sessions, and the likelihood of experiencing that recurrent low back pain is minimized dramatically. If you let it go beyond that duration of time, those outcomes are different. It may take longer to get better, and the recurrence rate is higher. So little just tips to try, and thanks for watching, and have a wonderful weekend, everyone.